and welcome to another episode of Code Rhetoric with Tam Talk. On today's video, we will be reviewing some of the most common health laws and statutes specific to medical coding and healthcare. Again, this list is not an exhaustive list of health laws and statutes, but we will focus primarily on maybe the top 4 or 5 that we need to pay close attention to as medical coding professionals. Okay, so we have some key health laws that are specific to medical coding. And as you can see here, this is not the exhaustive list of health laws or laws in healthcare, but I wanted to kind of highlight or provide an overview or some of the key ones that are specific that may tie into us as medical coding professionals. And that includes the False Claims Act, the Anti-kickback Statute, Stark Law, and then the Civil Monetary Penalty Laws, or known as CMP. And I also failed to mention the OIG, which is the Office of Inspector General, but that'll be for another video. So yeah, so we'll go ahead and get into this tutorial, or just kind of give you again an overview and oversight of some of the key laws that are specific to medical coding and healthcare. And again, this is not an exhaustive list. Okay, so first up, we have our Stark Law, and we have our reference or statute information listed next to it. So pretty much the Stark Law prohibits physicians from referring patients to receive specific designated health services that are payable by Medicare as well as Medicaid from entities or other health facilities in which the provider or physician or his or her family member has a financial relationship, unless they fall under the exception rule. So when it states an immediate family member, that entails parents, sisters, brothers, daughters, sons. It could be grandparents, parents as well. So what we typically deem as immediate family member is the nucleus family, such as parents and the children. But in regarding to the laws, the Stark Law, that includes like siblings, again, children, nieces, nephews, grandparents, aunts, and uncles. And also, the Stark Law further requires the resulting financial relationship to fit within an exception, or you may not refer patients to that facility, and the entity may not bill for the referred imaging services. So in this example, they're specifically referencing imaging services like radiology services, right? So if a physician evaluates the patient and decides to refer a patient to a facility in which this physician has some financial relationship, for example, they may be part owner of that entity, or maybe their family member is part owner or owner of that entity or facility, the physician cannot refer the patient to that facility because, again, that's where, again, fraud comes into play, or I would say kickbacks. And so you want to make sure that the facility or the referring physician or facility falls within the exception rule. And so what I have included for you is a reference link to kind of get a little bit more insight or read up on what exactly does the exception rule means, what the requirements are for that, and then to give you a little bit more insight into the Stark Law. Okay, so now we're moving into the False Claims Act. So what exactly is the False Claims Act? So the False Claims Act is related to the proper billing of medical claims. So this particular act is specific to our industry as medical coding professionals. We want to make sure that the claims or the codes that we are assigning, or the claims that we are submitting to our payers, primarily our government payers such as Medicare and Medicaid, are not false claims, that we're not unknowingly adding diagnosis, adding services, procedures to an account or to a record in order to seek reimbursement from the government. Okay? Or let's say that we unintentionally submitted some wrong codes, right? Like perhaps a guideline change and we weren't up to date on the guideline changes, and we're submitting claims, but then it was brought to our attention because the insurance carrier did make payment on those claims. So now that it was brought to our attention and we need to reimburse, we need to make sure that we are reimbursing or refunding those monies for those incorrect claims. And then we want to submit the correct claims to the payer for the appropriate reimbursement. So all of those things fall under the False Claims Act. And I did leave a reference down below for you to follow up for a little bit more insight and more information as it relates to the False Claims Act. So next we have the Anti-kickback Statute. So the Anti-kickback Statute is again related to the referral relationship between that of a hospital, physician, or ambulatory surgery center, or any healthcare entity. It is a criminal law. The Anti-kickback Statute imposes criminal penalties on anyone or anybody who improperly offers to exchange anything of value to encourage or induce a referral of business from a federal health care program. So a good example of that is a provider, hospital, or entity receiving financial incentives for referrals, free or very low rent for office space, or excessive compensation for medical directorships. Again, I have added a link for you to get a little bit more insight onto the Anti-kickback Statute. What I am providing here is just an overview of the anti-kickback, and I encourage you to fully read the statute and how it relates and pertains to us as medical coding professionals. So we're getting into the civil monetary penalties law. So the CMP, or shall I say the OIG, or the Office of Inspector General, they may seek civil monetary penalties and sometimes exclusion for a wide variety of conduct, and it is authorized to seek different amounts of penalties and assessments based on the type of violation at issue. So the penalties can range from $10,000 to $50,000 per violation. So let me put that into perspective for you. So if there is like 5 or 10, I'm gonna say 5 violations, and let's say they're each at $10,000, so that's $50,000 that a healthcare provider or healthcare organization or entity have to pay the government for fraud. And then if it's a provider, they run the risk of being excluded from providing services or excluded from Medicare and Medicaid. Okay, so some examples that are, say, examples of issues that may cause you to be excluded or to, be required to pay a penalty, includes providing false or misleading information expected to influence a decision to discharge. Again, that kind of goes back to that False Claims Act, submitting false claims. And then we have presenting a claim that the person knows or should know is for an item or service that was not provided as claimed or is false or fraudulent, right? Again, that goes back to the False Claim Act. And then making false statements or misrepresentations on applications or contracts to participate in the federal healthcare program. So that's more on the business side of healthcare, as they're dealing with contracts with the payers and as well as the healthcare entity. So again, you want to make sure that when you're reviewing an encounter or reviewing a chart, that you are appropriately assigning the correct, whether ICD-10 codes or CPT codes, as well as modifiers, to your claim, and you're assigning those codes based upon the documentation that is in front of you. You don't want to assign codes that are for services or diagnoses that aren't presented. Okay, so again, because if not, not only will the provider or the healthcare entity run risk of penalties, coders also are included. Coders also will be required to pay for penalties associated with committing fraud or violations with the governmental payers. Okay. So that concludes our quick video on some of the key health laws that are associated with healthcare as it relates to medical coding. So for those of you who are studying to become a coder, I just wanted to bring those to your attention so that you are aware what the laws are that are specific to medical coding, medical billing. And for those of you who are currently in the role of a medical coder or a medical biller, you may have heard these terms or these laws and statutes floating around, and yes, these are true, and yes, there are healthcare entities as well as healthcare providers and even some coders who have faced the penalties or jail time based on some of the issues that have occurred, and again, based on the laws and statutes that are monitoring healthcare. So yes, so again, this is just a quick tutorial. This is not an exhaustive list of the laws that are specific to healthcare, but some of the key ones that I wanted to bring to your attention. So yeah, so that concludes again this video. But also, if you want to get in contact with me, or if you're interested in learning more about compliance and medical coding, please feel free to visit our website at www.abrahammedicalcodingcoachllc.com. We're on LinkedIn, we're on Facebook as well as Instagram, and on YouTube. So yes, so I look forward to bringing you more information to ensure your success as a medical coding professional in the healthcare industry.